The breast is not directly part of the female reproductive organs, but it is closely related to the reproductive system. Breast connection. The breast is actually an accessory organ of the reproductive system. Its primary function is to produce milk for feeding infants, which is essential for their growth and development. Let's learn more about breast. Today we're going to discuss the amazing journey of breast development and its transformations throughout a woman's life. 1. What is the main function of the breast? Answer: the main function of the breast is to produce milk for feeding infants. 2. What are the two main types of tissue in the breast? Answer: the two main types of tissue in the breast are glandular tissue and fatty tissue. 3. What is the role of glandular tissue in the breast? Answer: glandular tissue produces milk and is responsible for lactation. 4. What is the function of fatty tissue in the breast? Answer: fatty tissue provides support and cushioning to the breast. 5. What is the nipple? Answer: the nipple is the small, raised area at the center of the breast that secretes milk during lactation. 6. What is the areola? Answer: the areola is the pigmented area surrounding the nipple. 7. What are lobules? Answer: lobules are small, rounded masses of glandular tissue that produce milk. 8. What are ducts? Answer: ducts are narrow tubes that connect the lobules to the nipple, allowing milk to flow. 9. What is the role of connective tissue in the breast? Answer: connective tissue provides support and structure to the breast. 10. What are suspensory ligaments? Answer: suspensory ligaments are fibrous bands that connect the breast to the chest wall, providing support. 11. What is the axillary tail? Answer: the axillary tail is the extension of breast tissue into the armpit area. 12. What are intramammary lymph nodes? Answer: intramammary lymph nodes are small lymph nodes within the breast that help filter lymph fluid. 13. What is the function of blood vessels in the breast? Answer: blood vessels supply blood to the breast and help regulate milk production. 14. What is the role of nerve endings in the breast? Answer: nerve endings provide sensation to the breast. 15. What is the pectoral fascia? Answer: the pectoral fascia is the layer of tissue that separates the breast from the chest wall. Here are 50 questions and answers about breasts, including some related to breast health. Breast development and structure. When does breast development start? During fetal life, around 6 to 8 weeks after conception. What is the role of estrogen in breast development? Estrogen stimulates breast growth and development. What is the function of glandular tissue in the breast? Glandular tissue produces milk. Breast changes during pregnancy and breastfeeding. What changes occur in the breast during pregnancy? Hormonal changes prepare the breast for milk production. When does milk production start after birth? Around 3 to 5 days after birth. How often should a newborn be fed to regulate milk supply? Frequent feeding, 8 to 12 times in 24 hours. Breast health and common issues. What is the most common breast problem? Breast pain or tenderness. What is mastitis? An infection of the breast tissue. How can nipple soreness be prevented? Proper latching and feeding techniques. What is breast engorgement? Swelling due to milk buildup. Breast cancer and screening. What is the recommended age for annual mammograms? 40 years old. What is a breast biopsy? A procedure to remove tissue for cancer diagnosis. What are the symptoms of breast cancer? Lump, change in size/shape, nipple discharge, etc. How often should breast self-exams be performed? Monthly. Breastfeeding and lactation. How long should a mother breastfeed? At least 12 months. What is lactation? Milk production. How can milk supply be increased? Frequent feeding, proper latching. What is breast milk composition? Water, carbohydrates, proteins, fats. Breast augmentation and reduction. What is breast augmentation? Surgical implantation of breast prostheses. What is breast reduction? Surgical removal of excess breast tissue. Breast reconstruction. What is breast reconstruction? Surgical rebuilding of the breast after mastectomy. Breast health myths and facts. Myth: small-breasted women can't breastfeed. Fact: breast size doesn't affect milk production. Myth: breast cancer only affects older women. Fact: breast cancer can occur at any age. Breastfeeding benefits. What are the benefits of breastfeeding? Boosts immune system, promotes bonding, etc. Breastfeeding challenges. What are common breastfeeding challenges? Latch issues, supply problems, nipple soreness. Breast pain and tenderness. What causes breast pain? Hormonal changes, breastfeeding, etc. How can breast pain be relieved? Warm compresses, proper bra fitting, etc. Breast infections. What is a breast abscess? A pocket of pus in the breast tissue. How is mastitis treated? Antibiotics, rest, and proper breastfeeding technique. Breast lumps and cysts. What is a breast lump? An abnormal growth in the breast tissue. What is a breast cyst? A fluid-filled sac in the breast tissue. Breast cancer treatment. What are the treatment options for breast cancer? Surgery, chemotherapy, radiation, etc. Breast reconstruction options. What are the breast reconstruction options? Implants, tissue flaps, etc. Breastfeeding and medications. Can breastfeeding mothers take medications? Consult a healthcare provider. Breastfeeding and nutrition. What nutrients are essential for breastfeeding mothers? Protein, calcium, iron, etc. Breast changes during menopause. What changes occur in the breast during menopause? Decreased glandular tissue, increased fatty tissue. Breast health and nutrition. How does diet affect breast health? A balanced diet supports breast health. Breast cancer risk factors. What are the risk factors for breast cancer? Family history, age, etc. Breast self-exam. How often should breast self-exams be performed? Monthly. Breast density. What is breast density? The amount of glandular and fatty tissue in the breast. Breast ultrasound. What is a breast ultrasound? A non-invasive imaging test. Breast MRI. What is a breast MRI? A non-invasive imaging test. Breast biopsy. What is a breast biopsy? A procedure to remove tissue for cancer diagnosis. Breast cancer stages. What are the stages of breast cancer? Stage 0 to Stage 4. Breast cancer survival rates. What are the 5-year survival rates for breast cancer? Vary depending on stage and treatment. Breast reconstruction risks. What are the risks associated with breast reconstruction? Infection, scarring, implant rupture. Breastfeeding and breast cancer. Does breastfeeding reduce the risk of breast cancer? Yes, slightly. Breast density and cancer risk. Is breast density a risk factor for breast cancer? Yes, higher density increases risk. Breast cancer genetic testing. What is genetic testing for breast cancer? Testing for BRCA1 and BRCA2 genes. Breast cancer treatment options. What are the treatment options for Stage 0 breast cancer? Lumpectomy, radiation, or mastectomy? Breast reconstruction options. What are the breast reconstruction options after mastectomy? Implants, tissue flaps, or no reconstruction? Breastfeeding and breastfeeding support. Where can I find breastfeeding support? Lactation consultants, breastfeeding support groups. Breast cancer clinical trials. What are clinical trials for breast cancer? Research studies testing new treatments. Breast health and wellness. How can I maintain good breast health? Regular self-exams, mammograms, healthy lifestyle. Thanks for watching. If you want to see more videos, check the playlist. Please subscribe the channel.